Welcome to Fast Applications of Neuropracticity, Part 21, where we're going to talk about functional gait disorders. We're in our third installment of functional conditions and invisible conditions. We're at Part 21. My name's Mike Studer, and I'm your host. Let's get started looking at this article by Nanekis and colleagues from 2020, identifying 7 different signs of gait that can help us rule in a functional gait disorder. Notice how I paused there. Help us rule it in. 2 important things there. We do rule in functional conditions, and we can't just use one sign, one test to confirm a diagnosis. Much more to be said about that. So put an asterisk next to each one of these. These help us accumulate enough findings to rule it in. Number 1, when we see inconsistency, variability, and/or spontaneity in the individual's presentation during ambulation in absence of trauma. Number 2, when we see scissoring, but the clinical examination shows no reason or rationale why, no spasticity, normal reflex testing, and may even disappear in backwards walking. Watch for a theme there. Number 3, when we have give way knee or buckling knee or even Trendelenburg gait, very closely related to number 4, antalgic gait, both of these conditions, both of these presentations will tend to disappear. They'll be inconsistent. They won't happen if the individual can run. They won't happen with stair climbing. They'll be variable. They may disappear with hopping, backward walking. Again, watch the trend there. Number 5, abnormal posturing of the arm or trunk that, guess what? Yes, disappears in backwards walking. Same thing with number 7, excessive slowness in walking that dissipates as the individual continues on, might be absent in sideways or backward walking. Jumping back up to number 6, certainly hemiplegic or dragging of a limb on one side. You guessed it, disappears, inconsistent, may not be present in backwards walking. Let's add in the presence of a Hoover sign. Again, Nanekis and colleagues, this is a great resource for exactly these 7 signs. They have some wonderful videos online when you look at this article as well. All right, so stepping away from that article, the next step, no pun intended, in functional gait disorders, once we've observed something that gives us the suspicion that we're going to rule this in, we want to corroborate these findings with history and other examinations, other tests, again, reflex testing, muscle testing, other signs, reassure the diagnosis and begin to educate, measure the gait performance to grab an objective baseline, identify triggers that may be influential in this individual's presentation, learn more about the person by identifying their preferences and their readiness to change. Seek further information on the readiness to change model if you're not familiar. Communicate your own vicarious experiences, and the circuitous path of recovery doesn't always follow a nice, even, straight line with consistent recovery all the way to resolution. And finally, collaboratively set goals with the client, patient, but make certain these goals have an internal focus, meaning we don't set goals that means your knee will buckle less than 5 times in a 100-foot walk. We don't set goals with internal focus. All right, that's a ton to say in a very short period of time, but that's what fast applications of neuropracticity are all about. Thanks for watching. You know the drill, Instagram and YouTube here.